Lots of people wonder, how should you time contractions? The best way to do it is to start from the beginning of one contraction until the beginning of the next. So if you're with somebody, you can just let them know by giving them the high sign that the contraction's starting, and they can look at a timer, and then wait until the next contraction is starting and they can look at the timer again. So that would be how far apart they are. So if one starts at 10 minutes after 5 and then the next one starts at 15 minutes after 5, your contractions are 5 minutes apart. Now how long they are is from when the pain starts until when that particular pain stops. So that could be 15 seconds, 30 seconds, 90 seconds. So those are the different things we talk about with a contraction. There's both how far apart are they and then how long is it lasting. So in early labor, things are definitely happening. Sometimes it can be frustrating because you get your cervix checked and it hasn't changed a lot. That number isn't a lot higher, but that's okay because every contraction does something. I really don't believe in false labor because there's nothing false about it. Everything that happens to our bodies is real. So in early labor, there's the things that are happening is one thing, your uterus is learning how to make a really good contraction. So some contractions are just in one part of the uterus and other contractions are the whole uterus. But what we want to do in early labor is help our uterus learn how to make an effective contraction so that when we get into active labor, they're much more effective. So that early labor, your uterus is learning what to do and your cervix is getting ready to open. So there's lots of subtle changes that you might hear the midwife talk about when they're checking your cervix in early labor. Lots of times we just focus on that number. Is it open 1 centimeter? Is it open 10 centimeters? But other things that are happening is your cervix is thinning out. So when we're not in labor, our cervix is long. It's about 2 centimeters long. And as we're in labor, that thins out. We call that effacement. It's kind of like if you were pulling a turtleneck over your head and coming out. So that's what's happening is your cervix is thinning out like that, making it easier for it to open. The other thing that's happening is your cervix is getting softer. When we're not in labor and we're walking around, our cervix is about as hard as the tip of our nose. But as we move forward in labor and in pregnancy, our cervix gets soft, almost like the center of our cheek here. So that's the other thing you'll hear us talking about. Is the cervix soft, or is it medium, or is it hard? And that helps us to know if the cervix is what we call ripe or ready, kind of like a piece of fruit. The other thing that we'll talk about is, where is the cervix? Is it still really far back? One of the amazing things that our body does is it sort of stores our cervix way in the back to protect our babies when we're pregnant. But as we get ready to give birth, our bodies know that the door needs to come forward so it can open. So before we're in active labor, the cervix is way back, but as we get into active labor, it's going to come more forward. So you'll hear us talk about that. And the other thing that's happening is your baby is starting to come down into the pelvis or into the birth canal. And that we talk about as station. How far down or how far up is that baby? So those are some of the different things that we're looking for when we do an exam. And some of those more subtle changes are happening during early labor or pre-labor, we sometimes call it. Active labor is when those contractions are nice and regular, coming every 3 to 5 minutes. And then we hit a point that we often call transition, and it's that last little bit when your cervix is now opening, usually from 7 to 8 centimeters to that 10 centimeters or all the way open and time to push. And that time of transition can be some of the most intense time of labor. It can sometimes feel overwhelming. You can feel sometimes like your body is shaking or you're sweating on your face because your body's working really, really hard to open those last few centimeters. And it's this point where I think it's important to remember that women have been doing this for millions of years and that your body knows how to do this. And you don't need to think about everything that's coming or what has passed or what's ahead. Just be in that moment. And if you can get through that moment, then all you have to do is get through the next moment, because this is an intense time, but it's something your body knows how to do. So this transition period lasts, like I said, from about 7 to 8 centimeters until 10 centimeters. And one of the things you start to notice during this time is that the baby's head is coming lower, and that starts to give you that sense like you want to push. And sometimes it just comes over you. You just feel like, ugh, like your body needs to push. It's a natural reaction. And sometimes that's a sign that you're 10 centimeters without even checking your cervix. We can know, yep, your body is telling you what to do, and it's time to push. And that moves into what we'll call second stage, or the time to push. And that can be a very different amount of time. Sometimes if it's your second, third, fourth, fifth baby, you hit that 10 centimeters and that urge to push, and your baby can be born in a matter of minutes. And you'll hear people talking about that. Their water broke and the baby just came out. But most of the time, there's some pushing involved. And that pushing can be anywhere from a few minutes up to 4 hours. And it depends on lots of things. How high was the baby when we started pushing? Did you have an epidural, or did you have all of your sensation? Because it just naturally takes longer to push if you have an epidural. And that's okay. But you need to have that mental mindset that this is going to be a while and it's okay.
When the baby comes out, baby comes down, it has its chin tucked, its arms come nice and tucked in, at least they're supposed to. Stay tucked in.
And sometimes when we're pushing, it can be frustrating because the early process is slow.
Baby will be coming down into the pelvis and pushing to get this part of the head to start showing out your bottom, out your vagina, often is the longest part.
But remember that once that head comes around the curve of the bone and really comes out like this, that's it.
And we start seeing about this much of baby's head, things start to speed up a lot. And once baby's head is all the way out, babies turn to the side and their shoulders come down and their shoulders come out, and they come out very quickly.
So the slow part is waiting to see the top of your baby's head that actually is out in the light and in this world. And once that head comes out, your whole baby is going to come into your arms. After your baby is born, the midwife will most likely just take it right up into your arms and be here skin to skin on your chest. And we'll let the baby be there, dry the baby off, and wait for a little bit. Because in those first amazing minutes, the cord to your baby is still attached to the placenta inside your body, and your baby is getting oxygen and good nutrients from that cord. And so we want to leave the baby connected as your baby's taking those first few breaths, because amazing things are happening as your baby shifts from getting all the oxygen through the cord to now breathing on their own. And so lots of things are happening, and we can support your baby by keeping your baby connected to the cord for those first few minutes. After your baby is born, there's still one more thing that needs to be born, and that's the placenta. It usually comes in the few minutes, 5 minutes, 15 minutes, sometimes up to 30 minutes for the placenta to separate from the inside of your uterus and come out. It can be helpful for you to push when the placenta comes out. It feels funny, but remember, it doesn't have any bones, so it doesn't hurt in the same way. You'll actually feel a big sense of relief once the placenta is out, and your uterus can start to clamp back down to stop the bleeding. After your placenta is born, if you want to see it, make sure and ask the midwife, because this is your moment and your chance to see this one disposable organ known as the placenta that helped to feed and raise your baby while it was in your uterus. After that placenta comes out, the nurse and the midwife will massage your uterus, massage your belly, because we want your uterus to stay hard and contracted. That's what stops your bleeding. And you can help with that too. So ask the midwife or the nurse to teach you how you can rub your belly and keep your uterus good and contracted. And that will be less painful for you to be rubbing your belly and stop the bleeding in a normal way. Another way that helps to stop the bleeding and contract your uterus is by breastfeeding. Our babies can help us by starting to nurse in that first hour. And when they're nursing and suckling at your breast, it produces the hormone to clamp down your uterus. And you'll feel that, because when the baby is latched on well, you'll feel some cramping down in your belly, which might not feel great, but you can also know, oh yeah, my body's working just how it should, and my baby's helping me to stay safe and healthy.